This is Stinchfield. Here's your host, Grant Stinchfield.
All right, thank you so much, folks. And as always, don't forget, this podcast is brought to you by TWC.health/Grant. That, of course, is the wellness company. So proud to be associated with them. When we talk everything about COVID, your health, your well-being, the wellness company can help you. Talk about those critical thinking doctors. This is what the wellness company is all about, the prescription medications kit. I'll tell you a little bit about that as we get into the show. But again, TWC.health/Grant. I urge you to go there, see what the wellness company is all about, and prepare yourselves for most certainly what is to come. With that, I want to welcome my good friend, Dr. Peter McCullough, to the program. Doctor, I hope you had a great Christmas. Happy New Year to you. Thank you for coming on today.
Thanks for having me. Happy New Year to you as well.
All right, so I get an email from you this morning, as I always do, Courageous Discourse. I love it. I get so much content for all the programs that I do, and I see erectile dysfunction, low testosterone levels with COVID. Why don't you tell me about this?
You know, Grant, this has been a developing story, and I've certainly seen patients in my office, men with fatigue, muscle loss, decreased libido, and then tests that indicate that there's a form of testicular failure called hypogonadism that's acquired. And now multiple studies show, we've summarized this in Courageous Discourse Substack, that after COVID, particularly severe COVID, the male testicles are actually hit by the virus and testosterone level falls. And the pituitary hormones that are trying to stimulate the testicles, those actually go up. So we know the problem is at the level of the testicles. So this is with SARS-CoV-2 infection, COVID-19. And so my encouragement is for people suffering with long COVID, when they see their doctor, particularly men, that they should inquire about this and have the hormonal testing to make the diagnosis.
All right, so I'm a big fan of hormone replacement therapy, especially as you get older. I'm a 54-year-old man. I take testosterone shots. I've got a very regimented protocol of getting tested. I started about every 3 months. Now I get tested every 6 months for my levels. And there's a whole bunch of, I could do a whole show on my anti-aging doctor that helps me with this stuff. But testosterone is so important to everybody, including women, but especially men. As you get older, they drop. Is this the virus that's causing it? Because you may say, too, well, could it be the vaccine that causes it? How do you tell the difference between what's causing it later on down the line?
You know, the Chinese published a paper early on in the pandemic of male orchitis, evidence of inflammation of the testicles with the infection. This is before the vaccines. It was an ultrasound-based study. They did a very rigorous evaluation of the testicles with ultrasound. They proved that, in fact, the testicles were being harmed. And the papers that exist so far largely are restricted to those with severe COVID-19 or admitted to the hospital. So this could potentially happen with other severe illnesses when someone's in the hospital. But we've had two papers with the vaccines, one by Gatt in the journal Andriology, the other one again by the Chinese, showing a reduction in sperm count and motility with COVID-19 vaccination. And they didn't measure testosterone levels or the LH and FSH levels from the pituitary, but I anticipate those would be abnormal. This is what the concern is, Grant, is that all men are in a range of fertility. Those at the lower end of the range, by taking a shot or having severe COVID, they could actually move into the infertile range. So male fertility almost certainly affected with COVID-19 vaccination and probably superimposed COVID. And then this drop in testosterone levels, which looks like it's sustained after infection, needs to be evaluated. And as you pointed out, testosterone replacement therapy has really progressed scientifically. It needs to be carefully done with the proper monitoring, but it is benefiting the health of men. And actually, testosterone is one of the leading determinants of libido in women.
So it's interesting. We talk about all of these symptoms of COVID, following COVID, now testosterone levels dropping. I've got a cough that I can't get rid of for 6-8 weeks. I experienced this about a year and a half ago. I worry some of it's asthma. I get sick and then I can't break the cough. But I'm wondering, I was never vaccinated. Thank God I didn't get vaccinated. I've had COVID. I know it because my levels, my antibody levels are way up through the roof always. So I think I've experienced. I stopped testing altogether, which I'm curious, do you think that's a good idea? Should you be testing for COVID or does it matter anymore?
I think once you've had the infection once, Grant, it's well documented. The second infections are characteristically mild. It doesn't really have any particular import. I'm personally not doing any testing. I've had the illness twice. Like you, have had a few upper respiratory illnesses since that time with prolonged cough. And I would bet that you have what's called post-infectious asthma, that when you do get a viral upper respiratory tract infection, it triggers the asthmatic response, which is both inflammatory and bronchoconstrictive. And it takes some effort to get out of it. On a few occasions, I haven't myself. I've actually, had to use inhalers and even a brief course of corticosteroids to pull out of it. But I encourage everybody now to really work on their fitness. I will have a Substack coming out on the new JN1 variant. This is the new Omicron subvariant. It's now becoming the dominant, 44% of the strains as of December 23rd, 2023 by the CDC nowcast system, which is very accurate. This is a derivative of the BA286 virus, which was more severe. I got a call yesterday about a nursing home in Dallas where it's on the move again, the JN1 variant. We don't recommend more vaccines. The current XBB 1.5 vaccine has zero coverage against the JN1. That's actually proven in the literature. So this is not something we can vaccinate our way out of, but we need virucidal nasal sprays and washes, McCullough protocol, the multi-drug protocol. All of this is available, especially with the key components in the wellness company COVID kit.
Yeah. And for all of you out there, that's a great intro to twc.health/grant. The wellness kit is fabulous. I've already used it. I used it to combat strep throat before I really got strep throat, and that worked, kept me safe. But this is times of emergency. We know, who knows what can happen. We're already experiencing drug shortages throughout the country. God forbid there was some kind of event, whether it's a natural disaster or a terrorist attack. You got drugstores closed. You want these medications on hand. twc.health/grant. And also, Doc, I think I don't talk about it enough on this program, but the concierge aspect of this, being able to call a doctor and talk to them about something where, now you try to get in the doctor's office. Even my kid, the pediatrician, I can't get him in. It takes days. And meanwhile, speed of action is the key to surviving all of these things.
Grant, you're so right about this. The wellness company, the Blue Emergency Medical Kit, that would cover an acute bladder infection, bronchitis, strep throat, fungal infection, a yeast infection. And think about let's say a man or a woman developing a urinary tract infection on a Friday night. You go to the urgent care, it's almost always out of network or a huge deductible. We're talking well over $1,000 for just a simple bladder infection. One can actually make their own diagnosis. They can call the physician line there that comes with the kit and just be sure if there's, any question, the doctor can order, a urine test at one of the big laboratory firms. But most of the time, the women they know what's going on with their body and get going with the appropriate antibiotics. Yeah,
that's the key. And it's one of the great benefits of the wellness company, twc.health/grant, which leads me to the question I wanted to ask you. We talk about ED, drop of testosterone. I've always been so critical of the media, of the left, of hyping COVID as the disease the virus you're going to die from, and we've got to lock down, and we know they weaponized it against society. But as I start to see some of this information start to drip out, certainly your Courageous Discourse Substack has been great COVID-19 is real. I don't want to tell people it's not real. It's not a made-up virus. It's real, and it can have effects. I don't think it's as deadly as that they once predicted, or maybe once was. Your thoughts, Doc?
It's true. I reviewed this for the state of Texas, Grant. Both you and I live in Texas. I'm currently broadcasting from Colorado on vacation. But, in Texas, the COVID death count is about 92,000 from the start of the pandemic. Now, that's, with all the caveats on, very liberal coding for COVID deaths, only 1,500 of those occurred in 2023. The hospitals have been empty now for a couple years. So COVID respiratory illness in my experience, is very easily handled with the McCullough protocol. The wellness company doctors know how to handle it. We've got this. But Grant, what you're pointing out is the complications are still coming. Do you know, in my office, I see people who've had a couple episodes of COVID and they come in with huge blood clots. I mean, this is very disturbing. 3-foot blood clots in the legs. I had a woman come in amputated last week, and it was from blood clots that shot to the leg. No vaccine. She just had COVID a few times. And certainly people are struggling with this long COVID syndrome. It's one of the reasons why myself and Dr. Proctor and our clinical group have published McCullough Protocol Base Spike Protein Detoxification. The spike protein is accumulating in the body of people who've had COVID multiple times and who take vaccines. And we actually need to get it dissolved or degraded in the body with 3 natural products: nattokinase, bromelain, and curcumin. That's the best science that we have right now. It takes a long time, about 3 to 12 months, but we have to get going on detoxification.
Yeah, and again, that nattokinase you can get at the wellness company as well, twc.health/grant, twc.health/grant. You talk about the blood clots, Dr. McCullough. I can't remember. I did an interview on Real America's Voice with a data analyst. You may have shared my interview on Twitter. It got shared widely, including Marjorie Taylor Greene, the congresswoman on the COVID Select Committee, calling for further investigation of these clots. This data analyst sent a survey out to 1,700 embalmers, so people who deal with dead bodies and embalming them. And pre-2020, they saw 0 blood clots, virtually 0 blood clots in the bodies coming in to be embalmed. 2021 and 2022, the numbers start to increase. 2023, the numbers start to decrease again. But clearly there's an issue. And there was like 70% increase from year to year in blood clots in these bodies. And the question then becomes, is it COVID causing the blood clots, or is it the vaccine causing the blood clots? Because clearly the only 2 events that happened post-2020 is COVID and the vaccine. Now the question becomes, how do you determine which is which and what's causing it?
It's going to be terribly difficult to separate the two. 70% of Americans took COVID-19 vaccines, 30% didn't. 97% of us have had COVID at least once, many of us both times. The spike protein from the virus and from the vaccine is found in the blood clots, Grant. It clearly causes blood clotting. The report you did with retired Air Force officer Tom Haviland, who did a survey of these embalmers, these morticians, it was stunning. In the pandemic era, they are finding basically what's considered organized, rubberized, white, long blood clots. And this is what we're seeing in our practice when we do ultrasound. We can actually see this physically in the living human body. And it's a manifestation of this SARS-CoV-2, this manufactured virus from this Chinese biosecurity lab. It's a very, very unnatural protein. Human body's never seen it before. There's a paper by Brogna and colleagues. This is stunning. They found the vaccine spike protein, which there is a way to identify the spike protein from the vaccine, because Pfizer and Moderna insert these 2 proline insertions to hold it open, and what's considered the pre-fusion conformation. This thing goes in the bloodstream. It circulates in the bloodstream, Grant, like a spear. And they found it in the bloodstream 6 months after people have taken the shots. We don't know how long this stuff is circulating in the human bloodstream. It really is a terrible thought.
It's absolutely terrible. And just a little note for all the viewers out there. This is what I love about you, Dr. McCullough. I did that interview last week. I could not remember the guy's name. So if you notice, I conveniently skipped over his name. But Tom Haviland, Dr. McCullough, you remember everything. I've just got to ask you on a personal level. Do you have like a photographic memory? Because you are always naming the studies. You remember the interview that I did that I can't remember. Maybe that's a result of my long COVID. But do you have a photographic memory? How do you do it?
No, Grant, I just make the effort to really, commit these names, the first authors, the key people, to memory because it's so critical in the time of a pandemic. People cannot freewheel. We can't accept our public health leaders or other media doctors just freewheeling. We need to be able to cite things. I think Substack's been a wonderful way to actually cite and anchor the literature. So what I want people to do is say, listen, I want to explore this further. At least they have a first name and they have a way to review it. Now, my Twitter feed, like yours, is a really good source, and I always give credit to the people on the interview. That was, by the way, a great interview because you actually showed the data, the results of his study. But what people need to know is in the time of a pandemic, they must seek expert opinions, multiple opinions, and do their own research.
Yeah, and that's the key. I think that we've come to a point where I remember I used to tell my grandfather when he was getting older, and there were a couple times I went to the doctor's office with him. Now, he was a major in the Marines, okay, fought on Guadalcanal and Peleliu and faced the most dangerous situation on earth, ran a company with over 800 men. This was not a shy guy by any means. But he goes into the doctor's office and doesn't want to ask questions about his health, doesn't want to talk to the doctor, just takes the doctor's word for it. And I'd be like, Grandpa, you got to ask why. Why should I do this? What about this? What about that? For the longest time, doctors have had this position in society that you just don't question them. I think we're at a point now, except for you, Dr. McCullough, we have to question doctors.
You know, Grant, even me, listen, we have to invite human inquiry. The population is becoming very, very medically sophisticated. Information is wide open. I think everybody should ask their doctor, did they take one of these COVID-19 vaccines? It's a very good proxy for a doctor's insight, their resolve. Doctors like myself who found these vaccines not to be safe from the very beginning, Grant. You know, I published an op-ed in The Hill in August of 2020, and the title of the op-ed, and this was for the House, the Senate, and the executive branch, was The Great Gamble of the COVID-19 Vaccine Pandemic. You know, I'm one of the few public figures that questioned the vaccines before they ever came out. They were never safe enough for me or my family. I never recommended my patients take these vaccines. I think people want to find doctors like that who are critical thinkers that can help them through the next stages of this pandemic.
Look, I early on went through the progression of, look, I'm not anti-vaccine. It's not right for me. You make the choice. Now I've been down the progression of, look, it's not right for me. I've made the choice. I don't believe it's right for you either. I'm going to tell you to your face, you can make the choice, but I think you're making a bad choice. That was not my spot early on. I just said, you choose. But I'm not a doctor, Dr. McCullough, as you know, but I came down to the most simple form as an investigative reporter for over 20 years, and there just was not enough time to even study it. Like, you can't tell me that you can put this to market and you know it's safe. There's no possible way to know it's safe.
Right. And, you know, to this day, there's no pharmacokinetic or pharmacodynamic studies. So we don't know how long the messenger RNA lasts in the body. It's been pseudo-uridinated. It has synthetic nucleoside analog caps. The messenger RNA has been found in the human heart in an autopsy study by Crossan and colleagues. It's physically there in the heart, causing spike protein and inflammation. Spike protein widely circulatory. I cited the Brogna paper, but it's also Swank and colleagues found spike protein from the infection and from the vaccine, as well as Ogata from Harvard has demonstrated this. If we could have known that the messenger RNA was not going to quickly be broken down and the spike protein was going to be widely circulatory for months, if not years, I mean, that in alone and by itself should have really tempered enthusiasm for this. The vaccine, in my opinion, was a giant mistake. Now the Association of American Physicians and Surgeons and the World Council for Health is calling for market removal of all the vaccines. If you follow Dr. Mary Talley Bowden down in Houston, she's keeping track of all the lawmakers now who have gone on record saying in the U.S. that we need to pull the vaccines off the market.
Yeah, I would certainly reiterate that push. I think that is the only thing to do. I think it actually is the greatest crime ever committed against humanity. I really do. When I look at all the evidence you've collected and others, that's what it says to me. Now, last question for you, because I know you're on vacation. You're so kind to take some time out for us today. You briefly talked about it earlier. we talk about this vaccine. I remember asking you a while ago, it may have been over a year and a half ago, is there a way to get rid of the vaccine? And at that point, I remember you saying, not sure yet. We don't know. And then the progression has been, you think it can be done. And why don't you just give me the last pitch of what you think can be done and how the wellness company can help?
We have been working on this clinically, Grant, for 4 years for long COVID, 3 years for the vaccine injury. It's due to the spike protein. There's no doubt about it. The spike is the problem. It's in the human body. We measure antibodies against it as an indirect measure. Soon we'll be able to directly measure spike. It's attached to red blood cells. It's within white blood cells and it's freely circulatory in plasma. It's in tissues. It's in the heart, the brain. So it's all about the Wuhan spike protein. Virtually everybody has it in their body. The Japanese led the way with nattokinase. They demonstrated clearly nattokinase breaks down the spike protein in intact cell models and cell lysate models. Bromelain, another substance, a natural substance, also breaks down the spike protein at different areas. And then curcumin antagonizes the effect of spike protein in the body, actually helps protect us. So those are the three components of McCullough protocol-based spike protein detoxification. This has been fully published now in the peer-reviewed literature, 2 papers, Journal of American Physicians and Surgeons, and this PubMed listed journal, Curious, from my group in Dallas. The nattokinase dose starting 2,000 units twice a day, bromelain 500 milligrams a day, curcumin, and we combine it with piperine to supercharge the absorption, 500 milligrams twice a day. These are starting doses. We can double it. We believe it takes about 3 to 12 months in our direct clinical observation where people improve. The headaches, the ear ringing, the heart pounding, blood pressure up and down, chest discomfort, tremulousness, all of this seems to improve, but it takes a long time. Now, we add other drugs. Recently, there's been support, believe it or not, for using a nicotine patch in a low dose, 7 or 15 milligram dose. That can actually help ameliorate symptoms. Doesn't get rid of the spike protein, so we add it to the base program. Hydroxychloroquine, if patients are autoantibody ANA positive, like Megan Kelly, she's got an autoimmune problem from the vaccine. And then we use colchicine, which was widely used in the treatment of COVID. We now use it for the chest inflammation syndrome. It's mandatory in those with myopericarditis. So you see a lot of use of these drugs in clinical practice. We add others, but patients with long COVID and post-vaccine injury syndrome should not suffer. They should get mobilized, see a doctor, go to the wellness company, and I advise that company as a chief scientific officer, get the proper nutraceuticals and drugs and get going on treating this problem.
And most of that protocol is not prescription medications. The nattokinase, right, is right. Just what you call a nutraceutical.
It's a nutraceutical, but it acts like a drug, Grant. Nattokinase elevates the D-dimer level. It's a form of a blood thinner. Bromelain is derived from the stems of pineapples, also like a drug. In 2022, the FDA approved bromelain as a topical drug used in deep tissue wounds to break down the thick eschar. It's also antimicrobial. Curcumin, by the way, has clinical randomized trials in humans showing improvement in long COVID and post-vaccine injury syndrome. So these are natural substances. You're right. You can get them without a prescription, but they work like drugs.
Yeah. And again, the wellness company is where to go for all this stuff and all the resources you need to make this happen for you and the doctor help you need, all right there. TWC.health/Grant, 10% off. And especially this very important kit with all the prescription medications, the antivirals, antiparasitics that you need to keep yourself safe. Dr. McCullough, I'll tell you what, it's always a pleasure talking to you. You've become such a good friend of mine over the years. I'm so proud to know you, and I'm grateful for you and the wellness company, and I appreciate you coming on.
Thanks. See you back in Dallas.
Absolutely, sir. And we'll see you again very, very soon for sure. All right, folks, that's going to do it for us. As I remind you, TWC.health/Grant, 10% off. Use the promo code. Don't wait. You don't know when an emergency is going to strike, and you want to be prepared. I've got ammunition. I've got my food supplies that last 25 years. Why wouldn't you have prescription medications on hand? God forbid you get a kid that cuts themselves. You got to worry about tetanus. Have the prescription medication on hand. Not to mention, as you said, the spike protein protocol. Get that out of your system. The doctor is ready to help you out for any situation that goes wrong. The wellness company is the one-stop shop. I'm telling you, folks, Get on board. Do what I do. Get with the wellness company. TWC.health/Grant. And again, folks, don't forget my website, GrantStinchfield.com, GrantStinchfield.com for all the podcasts. Sign up for the email list. And we will see you on the Real America's Voice show later tonight at 7 p.m. Eastern Time. God bless all of you. Stinchfield's Army rolls. We'll see you then.